next and final speaker today is Professor Eirik Årsand. Eirik has worked in the field of e-health and telemedicine for many years. He has been a professor since 2014, and his research focuses on how to use mobile technologies to improve self-management, primarily about diabetes. Eirik, you have your main position at the UiT, the Arctic University of Norway, but luckily you have a part-time position at our center. So we look forward to hearing your presentation. The floor is yours.
Thank you, Erin. Yes, I'm going to talk about the future researchers, namely also about education. So earlier today you heard a lot about research, but how can social media also be and should be used in education is the first issue I will start with. Why is it important to include social media in education? As you all know and have heard, it has become more and more prevalent and part of our all lives. And also for health purposes, it has become a great educational information source for many. Many gets quick help from the communities on social media, which they don't get instantly at the healthcare. For instance, getting help with devices and sensors outside office hours and when traveling. Actually, this morning I read on Facebook just to check, and there was one patient there that had lost her charger for her sensor, and they couldn't get hold of it. So she got help within, actually it was yesterday evening, she got help with one friend on social media very rapidly within an hour. So she didn't need to wait until the next day. So that's just an example. So it can also give reassurance and of course also bothering information if people talk about things that they are bothered with or is actually also not true. That could also be the case. So all these things are important to know about for the students and when we educate students. So how could they in practice benefit from social media? So we see that social media can be used for, by them to examine the state of the art, both for the assignments, for the reports, and also for their theses, and also to inform about the real user needs, which you don't so easily find in scientific articles, etc. But you find direct comments and direct information from the patient by when joining social media groups on Facebook, for example. They also have the chance to test a concept on real users quickly and easily, more easily than else. And of course, to do that, you need to understand and act on the challenges around ethics, around the privacy, and also around security. So I'm going to explain this by using 3 examples, so how we have done it at our university the last years. So the last semester, the spring semester, we had one student in computer science where she needed feedback of the state of the art. So for instance, how eager would people be to use social media chatbots, which we have heard about earlier today as well. So just within a week, she got 120 responses on social media, something which is really a lot giving this short time and this little effort. So by these responses, she posted a questionnaire. She was able to make very good statistic, and it actually also resulted in a conference paper. So that's a really good example how it could be used. The link for the conference paper you see down there. Another example is a master's student we have also last year that interviewed people with a hearing device and how they would like to be trained for their hearing device. So he got good feedback, also in a closed group on Facebook by users who were in the situation that they needed hearing device training. Yeah, so that's another example. The third and last example is 2 students right now this semester where they are in the phase of there's a course where they prepare the master theses, and they use closed groups on within diabetes to inform and to understand better what are the latest use of the technology, and also what are the users would like to use of technology that the 2 master students will use when they do their master thesis in the spring semester after Christmas. Yeah, so these 3 figures you see here, there are just 3 examples of these groups that the students have joined. So they can ask being part of social media groups, and you see one of them have almost 40,000 members. So it's a really rich source for information, in this case about people with diabetes. So how could we as teachers or professors use social media? Of course, we should educate the students about what people, for instance, discuss between themselves in addition to what they discuss at consultations in the health field. Namely, how are the patient empowered? So the empowerment, I think, is much easier to see when you visit a closed patient group where they actually are more free to discuss and say what they really feel and what they really mean when they talk to each other, opposed to when they talk to the clinicians. And we should also educate them on how they get this updated and also the real user needs, that is the day-to-day needs, which you will find much more of on social media groups. And also how you could safely test their concept on real users using social media. But then we need to teach them what are the requirements around ethics, privacy, and security. So there are procedures, there are things you need to do it safely. And so this is to teach the students how to use social media themselves, to inquire more new and different information than you will ordinarily find in the textbook and even in the scientific journals and articles you find out there. Yes, so that was how we could use social media to teach the coming researchers. So what about how it can be used actively in research? You have heard a lot about this today, so some of this is just a kind of a summary of what you already have heard, but perhaps some new elements. So you can, of course, very easily and quickly reach out to an audience, so you can get really quick feedback, which can be useful in an initial phase. For instance, we had a survey we wanted to be answered by a user group. In our case, it was people with diabetes. So we asked the moderator if it was okay to post this survey on their closed social media group. It's called CGM in the Cloud, and we actually reached out to more than 30,000 users at that point in a very quick and easy manner, and got good feedback very quickly and cheaply in a way. And you could also use it to recruit study participants in selected and in different groups than you else would be able to do, and to understand how what they are discussing outside the contact with healthcare services. So by doing that, you get a less biased results or understanding than you would ordinarily do if you go through the healthcare service. And of course, as I already said, but just need to be repeated for doing this, you must clarify this with the moderator of, if you use a closed group or a group, there is someone responsible for that group, and you need to ask them how to do it. And you also, so in some cases, if you're going to collect more detailed information, you need to ask the users themselves also. And you should not gather personal identifiable information. So this, you should also respect the group rules. To the right, you see an example of some group rules from one of the groups that I have mentioned. I also here give 3 examples. The first example is about initial user feedback. So we had the workshop. We needed to know how people is what they think about sharing data at consultation was our workshop about. And so before that workshop, we posted on our own research group's social media site. We have, so that's another way you could do it. You can also make your own site where you attract relevant users or spectators. So we have one called the Diverse Diary. We only had at that point 500 followers, but even though we got 15 useful answers to our survey that we posted some few days before the workshop, and we have this information headers in the workshop, giving us a much better start on that workshop. The other example, I think is already presented, but you can analyze discussions on social media. In this case, we could see by analyzing different groups on social media what are patients discussing versus what are healthcare personnel discussing on social media. And the third example, what engages users. Elia talked about that, but that's also another example on how that could be used by researchers. Yes, I think that was the examples and the things I had. Thank you for listening in.